explain a little bit like what the process is, maybe like the life cycle of hair? Is there anything that we can appreciably do about it? Because I feel like everyone, like today, I already got it twice today in clinic.
Totally. I mean, hair loss is really common. Now, I will say what's interesting is I was looking in the research in the literature and it's kind of mixed. Like some studies, and they're small, right? They're small case groups, so it's not like we're going to hang our hat on any of this. But some are like, no, semaglutide doesn't cause any hair loss, and some were like, yes, it does, and some were like, it's just related to the weight loss. I think it's related to the weight loss. I don't think it's a side effect of the drug. Now we know, so most people that you're talking to that are on these medications that are losing a lot of weight, it's going to be that stress related hair loss. It's the kind that, like, for those listeners who had a baby and afterwards, like 3 months after, their hair is just like coming out in chunks. It's the same hair loss, okay? We call it telogen effluvium. So the hair cycle, there's three types of hairs, but really for all intents and purposes, there's two types of hairs. There's growing hairs and there's sleeping hairs. Telogen effluvium is when the body releases the sleeping hairs. Okay. The body is like, we don't have enough nutrients. We're stressed out. We've got to like fight the battle here, right? Because your body doesn't know that like nothing bad is happening. Your body is like, this is a stressful moment and we need to conserve. So it's releasing those sleeping hairs, which is why a lot of them start falling out. You don't go bald from this. Okay. This is not that kind of hair loss. It will come back, but it comes back after the stressor has ended. Okay. Usually starts 3 months later. So as soon as you go on this med, it's not like your hair is going to start falling out. And it lasts until your weight is kind of stabilized. And it comes back a few months after that. And they come back slowly. And it's like I said, pregnancy is a common reason to have it, like delivery, I should say, not necessarily pregnancy, but delivery, being hospitalized for some reason, major life events like getting divorced, losing a job, like those are things that can do it. And then it takes time for the hair to grow back, okay? So if you're noticing that you're losing your hair, there's a couple things that you can do.